I'm Dr. Ajay Duseja from the Department of Hepatology, PGIMER, Chandigarh. And what I planned is just to give you an overview about hepatitis and in particular about the viral hepatitis. So in technical terms, when we talk about hepatitis, hepat or H-E-P-A-T, hepat in technical terms actually means liver. And itis in medical terms always means inflammation. So when we talk hepatitis, it actually means inflammation of the liver. In Hindi, I can say liver ki sojish, जो है उसको we call it as hepatitis. Now there are various causes of hepatitis, but the most common cause for hepatitis is what we call the viral hepatitis or viruses which cause hepatitis. Other causes can be, for example, somebody taking some medicines or drugs that can cause hepatitis. We can call it as drug-induced hepatitis. People abuse alcohol, they can have alcoholic hepatitis. Then you can have fat in the liver, which can again cause inflammation in the liver. We call it as steatohepatitis. Then you can have some antibody formation in the body, and then which can damage the liver, and we call it as autoimmune hepatitis. So there are various causes, but as I said, viral hepatitis is the most common. Now, what are the viruses which cause this hepatitis? There are certain viruses which selectively involve liver or preferentially involve liver. We call them as hepatotropic viruses, and these are actually named on alphabetically like A, B, C, D and E. These are the common 5 viruses, and there are certain differences between hepatitis A, E and B and C which I will try to explain you now. जो hepatitis A and E है, ये generally it causes acute hepatitis. Acute hepatitis का मतलब है एक self limiting disease, which means आज किसी को hepatitis हुआ 4-6 हफ्ते के अंदर ये ठीक हो जाएगा. Self limiting, patient just needs symptomatic treatment. Usually it starts with symptoms like भूख नहीं लगना या body aches होना, पेट में दर्द होना, हल्का सा बुखार आना, and then it is followed by jaundice. These are the typical symptoms of hepatitis. Then उसके बाद 4 हफ्ते 6 हफ्ते के बाद ये धीरे धीरे जो है कम होके एंड ये खत्म हो जाता है. This is self limiting. But then, and typically as I said, in children it is hepatitis A virus which causes this, and in adults hepatitis E virus causes this. This can happen in 2 kind of clinical scenario. Sporadic means किसी ने भी बाहर गंदा पानी या गंदा खाना खाया. ये जो hepatitis A और E वायरस का इन्फेक्शन है ये मुंह के रास्ते से होता है, ओरल रूट से हम कहते हैं. तो इसमें किसी ने भी बाहर गंदा पानी पी लिया या खाना खाया, उससे ये इन्फेक्शन आया. तो स्पोरेडिक मीन्स इंडिविजुअल केसेस भी हो जाते हैं या एक एपिडेमिक फॉर्म में भी कई बार आ जाता है. एपिडेमिक फॉर्म मीन्स दैट a large number of people in a community which has a common kind of drainage or common kind of supply of water actually can get affected. So that is known as the epidemic form. So दोनों forms में है, self-limiting है, but then uncommonly even this infection or what we call acute hepatitis actually sometimes can get a very serious, and patient may even may go into even liver failure to that extent कि उसको लिवर बदलने की नौबत आ जाती है, which means liver transplantation की जो है उसको जरूरत पड़ जाती है. हेपेटाइटिस बी एंड सी टिपिकली जो है वो क्रॉनिक हेपेटाइटिस करते हैं. जो हेपेटाइटिस बी जो है वो अक्यूट प्रेजेंटेशन भी करता है, जो मैंने अभी आपको बताया. Now typically as I said, hepatitis B and C when they cause chronic, they are usually silent, which means ज्यादा symptoms patient को नहीं होते हैं. अगर symptoms होते भी हैं तो वो नॉन स्पेसिफिक सिम्टम्स है. नॉन स्पेसिफिक मतलब बॉडी एक्स होना, लेथार्जी होना, भूख ना लगना, थके थके रहना, दीज काइंड ऑफ सिम्टम्स, राइट. तो इन सिम्टम्स के लिए या तो पेशेंट डॉक्टर को दिखाने जाएगा एंड देन ऑन ब्लड टेस्टिंग ही इज फाउंड टू बी पॉजिटिव, और एक हेल्दी आदमी से ब्लड डोनेशन के लिए ब्लड बैंक में जाता है, वहां ब्लड डोनेट करता है एंड देन ही इज फाउंड टू बी पॉजिटिव. दैट इज 2. और सम पीपल दीज डेज कैन गो फॉर एग्जेक्टिव चेकअप, and on executive checkup they are either found to be hepatitis B and C positive, or they are found to have abnormality in the liver enzymes. उनके जो liver के enzymes हैं, इनको हम SGOT-PT या AST-ALT कहते हैं, वो बढ़े हुए आ जाते हैं. वो बढ़े हुए आगे जब उसका कारण ढूंढने के लिए टेस्ट करे जाते हैं तब पता लगता है कि उनको हेपेटाइटिस बी या सी का इन्फेक्शन है. Since largely, as I said, these are silent, these two infections are also known as what we call the silent killers, because ultimately over a long period of time they can damage the liver to that extent कि लिवर में सिरोसिस हो जाता है, लिवर में स्कारिंग आ जाती है, लिवर में सिकुड़न आ जाती है, उसको हम सिरोसिस कहते हैं। और एक बार किसी को सिरोसिस हो गया, उसका जो है वो लिवर फेलियर में जा सकता है, अगेन टू द एक्सटेंट कि उसको लिवर चेंज करने की नौबत आ जाती है। Then these patients, those who have cirrhosis or those who have hepatitis B and C infection, they are also prone to develop liver cancer, जिसको हम कहते हैं HCC या हेपेटोसेलुलर कार्सिनोमा। वो लिवर कैंसर होने के भी इनके चांसेस जो है वो बढ़ जाते हैं। Now, इनका जो स्प्रेड है हेपेटाइटिस बी एंड सी वायरस का स्प्रेड जो है वो हेपेटाइटिस ए एंड ई से थोड़ा अलग है। इसका स्प्रेड प्रिडोमिनेंटली ब्लड एंड ब्लड प्रोडक्ट से होता है। तो जिन पेशेंट्स को ब्लड ट्रांसफ्यूजन हुआ हो या जो पेशेंट ड्रग अब्यूज करते हैं, आईवी ड्रग अब्यूज, इंजेक्शन ड्रग अब्यूज करते हैं या नीडल्स को शेयर करते हैं, रेजर शेयर करते हैं, टूथब्रशेस शेयर करते हैं, तो उनको ये इन्फेक्शन हो सकता है। देन दिस इन्फेक्शन कैन ऑल्सो गेट विद टैटूइंग वगैरह जो कराते हैं, और नीडल अगर सेम नीडल को बार बार यूज किया जाता है तो उससे भी इन्फेक्शन जो है वो फैल सकता है। देन दिस इन्फेक्शन कैन कम फ्रॉम मदर टू बेबी इफ मदर इज इन्फेक्टेड, से immediately after pregnancy or even during pregnancy. Then this can even spread sexually also between the partners, so that is another way of spread of these. So and if you look at these the spread modes of spread, they are almost similar to what you have in HIV या AIDS की जब हम बात करते हैं, उसका जो spread का जो तरीका है और इन viruses का जो तरीका है, that is almost the same. So आपको जो precautions लेने हैं इनके लिए वो इन्हीं चीजों के लेने हैं, that you should have a safe blood products, and आजकल तो सारे blood banks में hepatitis B और C की screening होती है, तो that is not an issue, but then you should not be using the disposable needle को reuse नहीं करना है, that has to be seen. Then you should have safe sex, and then I think mothers की screening जो है during pregnancy जो है वो I think that is very very important for these infections. So I think these are some of the ways where you can prevent these infections. Then prevention के लिए I think we have another thing for hepatitis B especially is that we have a very effective vaccine which is available, and this vaccine is usually given at birth to babies, and 3 dosages are required, but anybody who has missed this vaccination say at birth or even at childhood can have this vaccination at any age. So 3 dosages are required at 0, 1 and 6 months, and if somebody completes these 3 dosages, then he has more than 95% protection by developing antibodies to hepatitis B, and these antibodies are effective usually for 15 to 20 years. Similar kind of vaccine when we talked about acute infection are also available for hepatitis A virus. But then उसके लिए जो है usually that vaccine is given after 2 years of age in children, and then 2 dosages are required, and that is also very effective in more than 90-95% of people. Now those who have this disease, hepatitis B and C, I think उनका जो treatment now, we have very effective treatment which is available now. For example, for hepatitis C, the genotype, the kind of virus which is prevalent in India is treatable or is curable, I would say, in more than 70% of the time, which means you give them drugs which is a combination of injection, it's called interferon or a pegylated interferon, in combination with ribavirin, and it is effective in treating or curing this virus more than 70% of the time. New drugs are now coming in for treatment for hepatitis C, and rather there are no drugs available in the West or in the US. They have been approved where you have all oral drugs now available which are without this injection, and they are very effective, and they can be effective as high as 90% or 100% of the time they can cure the virus. We are still waiting for these drugs in our country, but I'm sure sooner they would be available in India also. For hepatitis B, again we have 2 kinds of medicines which are available. One are the injection, which is again interferon, either plain or what we call conventional, or we have the pegylated interferon, and then we have the oral drugs which are available. They are very effective, at least in reducing the viral load, which means they bring down the virus significantly down, and then they can even clear the virus in say 5 to 10% of the time. Even the virus can be totally cleared. But then, as I said, the reduction of the viral load is very important. The reduction in the replication of the virus is very important, which means virus जो body में active multiply कर रहा है, उसको किसी तरह से inactive करना जो है body में बहुत important है. Because even if you achieve that and even if you are not able to clear the virus, आपका liver damage जो है उससे बच जाता है. This is very very important. I think it's very important to know about these viruses, because overall अगर आप देखो hepatitis B and C मैंने बताया silent killers है, and अगर आप world population की बात करो तो there are around, it's close to around 700 or 710 crore population all over the world. And then overall around the 50-60 crore people actually are affected with this hepatitis B and C infection all over the world, which means actually, and even 5-6 crore people are infected with these viruses, hepatitis B, C in India per se. So which means that if you take say 50-60 crores of these 710 crores, it looks like that every 10th or 12th person in the world is actually infected with hepatitis B and C. Now, as I said, these are silent, so how do you know that, that whether the infection is present in the body? So the only way to know is to test yourself. So I think the World Hepatitis Day is coming very soon on 28th of July, which is celebrated every year, because this actually happens to be the birthday of the Professor Bloomberg, who was the discoverer of hepatitis B, and this day is celebrated as World Hepatitis Day the world over now. On this day, I would like to give one message, that if you are not vaccinated for hepatitis B, kindly vaccinate yourself, and otherwise, if you have not tested yourself for hepatitis B and C, kindly test yourself for hepatitis B and C and see whether you are infected or not. Thank you very much.